Hi, I'm Mary Nielsen, owner and educator at Spectrum Advanced Aesthetic Institute. Spectrum offers advanced training, hands-on education for licensed estheticians, medical assistants, and nurses who want to move into the really exciting but challenging field of medical aesthetics. Today we're going to talk about microneedling. Microneedling is an extremely popular treatment today. It originated about 20 years ago in Europe, where a plastic surgeon was having his facelift patients have their scars tattooed. And one of the things that he noticed was the tattooed scars looked better than the untattooed scars. And he realized that it was the needle from tattooing that was breaking up some of the fibrous bands in the scars and creating a beautiful texture with his patients. So microneedling was born. It's come to the United States. It's become one of the most popular treatments today. It's also called fractionated collagen induction, and it is used to stimulate the production of collagen. The indications for this treatment are the contraindications for this treatment are we're going to do a demonstration of the popular microneedling treatment, and we've chosen the Rejuva Pen today for that treatment. The reason I like the Rejuva Pen is a couple of reasons. First, the controls are on the handle, so you can control the speed of the device with an easy hand control. You can also control the depth of the needle at the top of the device. So the other reason I like it is because of the needle cartridge. The needle cartridges come in sterile containers. When you open them up, you can see that they're spring-loaded, and so they'll have to get screwed into the device this way. You screw them in, and then they have a really nice protective cover over the needles, which also pops off. You can see that the needle cartridge tip is beveled. This prevents any kind of suction or vacuum action that can happen and create some cross-contamination if your needle cartridge happens to be cracked. So it's a great device, and patients get great results. I'm going to put that right there. Okay, we're going to start on Suzanne, who is our model today, and we use a very light coating of a hyaluronic acid gel for Suzanne. This treatment is done most often using hyaluronic acid, although there's a lot of other products that are now being used. Most commonly is a growth factor serum or some kind of melanocyte inhibitor. The other thing that's often used is a vitamin C antioxidant. It does a great job with plumping. It can be used for acne scarring. It does a great job with fine lines and texture. First thing you want to do is determine the depth of your needle. And because we're doing the forehead, which is a very thin bony area, we want to make sure that our needle depth isn't too deep. So we're going to set this at a 0.2. What's nice about Rejuva Pen is that the needle depth adjusts from 0.2 millimeters all the way up to 2.5 millimeters. I'm going to turn it on. And we're going to do 3 passes. Today we're only going to do one on Suzanne's forehead. It's just a demonstration. You can see that you're first going to do a slow circular motion. And you'll cover her entire forehead. If Suzanne had a lot of forehead wrinkles, which she doesn't, thanks to Botox, we would do possibly a 4th pass, particularly focusing on those wrinkles. So if you had the glabella, which had some deeper wrinkles, you could do an extra pass. After you've done a full pass of circular, your next motion would be diagonal. And you're going to take diagonal from her eyebrow up to her center of her forehead here. It's going to cover the entire area. And then you're going to get the other side of her forehead. Now, when you do a third, then you're going to do a third pass. The third pass, you can decide, are you going to go vertical or are you going to go horizontal? So I'm going to choose to do a vertical motion. I just move slowly and evenly with even pressure across her entire forehead. You can see she's starting to get pink. That means that we're creating these little tiny micro injuries and creating some channels so that hyaluronic acid can get pushed into her tissues. If you wanted to, you could do a horizontal pass. Now, because we're creating these little tiny wounds in the skin, your body's going to respond to the wound by coming to heal that wound. And when it heals the wound, it heals up the wrinkles, repairs the texture, fine lines, etc. We're going to just make sure we wipe the area clean. I do use a sterile 4x4 when I do this treatment because I have created little wounds in the skin and I want to be especially cautious about infection control. Then we're going to move on to the side of her face. I'll have you turn this way slightly, Suzanne. Thank you. This gel can be a little bit cold. That's an eyelash. There we go. Put more of our hyaluronic acid on there. And we're going to get just her cheek area. Got a nice even layer. And now when we look at her cheek, we're going to increase our needle depth slightly. And we're going to go to about a 0.8 on the gauge. And then turn our needle on about medium. And then starting up here near her crow's feet, I'm going to be making my circular motion. One of the nicknames for this type of treatment is a vampire facial because occasionally you can get a tiny pinpoint bleeding. You can see right here she's got one little pinpoint area. I'm going to take our 4x4 and just dab that. Some offices, medical offices, use protein-rich plasma. They'll do a blood draw and they'll take the patient's own blood and they'll spin out the plasma, and instead of hyaluronic acid, they will use the patient's own plasma to infuse it back into their skin. Right, after we've done our treatment in a circular motion, we're going to go diagonal, and I'm going to go diagonal from her crow's feet down to her chin in kind of a steady, slow motion. Back over this way. Steady, slow motion again. And then for our third pass, I'm going to do a horizontal or vertical motion again. This treatment, after you've numbed for 30 to 45 minutes, with Suzanne we used a 4% lidocaine and then we cleansed that off prior to the treatment. But the treatment itself is actually pretty quick. Not a lengthy treatment, but patients see great results. It's best done in a series of 3 to 4 sessions that are spaced 2 to 4 weeks apart. We're going to cleanse or wipe off our hyaluronic acid. And then we're going to make sure that Suzanne puts on a nice physical barrier sunscreen today. Results that she'll expect is today she's going to look red. She's going to look almost like she's had a sunburn. Tomorrow she's going to be a little pink, but then by the next day she should be back to normal and her face is going to feel and look wonderful.